So, hi everyone. I hope all of you are doing well and your preparation journey is going fantastic as always, right? So, I hope you've gone through the previous videos of mine to get a glimpse of what exactly the NEET PG preparation has to be. And the furthermore videos are obviously going to keep coming on their time. But today I am here to talk about the most important exam, which is right now going around the corner, which is INICET, and the dates for which has already been announced, which is 5th of November, right? Now, some of you must be very clear about the schedule, what to go, how to go, and you know what you have to actually target on. And you guys must be going with the flow. So kudos, very nice for that. But for the people, for the category of students who are very confused, you know what you are actually supposed to target and how should actually be the preparation for this exam and whether or not you will be able to do or not. And all of these doubts, keep on. Coming in our heads and we are very confused about that, so I'm here to just help you a little bit regarding that, and I hope this video is going to for sure help you about that, right? So let's go ahead for that. All of us know the exam is on 5th of November. Now I want first of all of you to just remember and make yourself believe this particular fact that you can do it, right? There is no haywire that this exam is a very difficult exam, right? And it might be difficult for some people, but trust me, if your clinical knowledge is very good, if you have the concept of a particular topic, you will be able to crack good amount of MCQs in this exam as well. So INICET is a difficult exam and I cannot do it is a myth. Trust me when I say that. It's very easily doable. All you actually need is the right concept and the right mindset at the exam, right? So for those category of students who are just not going to attempt this exam or not going to appear for this exam just because of the fear that they cannot do it because it's a very difficult exam, I really humbly request all of you to just change this decision of yours and go and fill the form and do appear for the exam. Even if you're not targeting it, just appear for this exam as a GT, as a grand test, so you will get a glimpse of what the main exam NEET PG is going to feel like, what is the actual pressure, what is that fear, what are those confusions which are going to obviously be there on the main exam day, how you have to control your state of mind in the exam. So all of these you will actually learn it here. So please go and give this exam. Do not just skip this exam because you are just you feel like you will not be able to do that, right? Now, second most important thing, that INI is a very clinical exam. It's a very concept based exam. So if at all you are just reading your rapid revision videos or you are just reading your short notes and just thinking that this is going to suffice, trust me, it will not. Because if at all you do not have the particular knowledge in depth of a topic, you will not be able to crack the MCQ out of that, because they're going to put options in such confusing way, and they're going to twist the question in a way that you will be required to have the knowledge of that particular subject in order to get that question right? So read less, revise more. Do not just go after revising each and everything, but whatever you are reading and revising, just ensure you are doing it perfectly in a very conceptual manner, right? So as I told you, obviously it's a conceptual and a clinical based exam. Third and the most important thing, INI is very much about the previous year's questions. Right now, obviously INI May 23 was little out of the box exam. It was not much focused on the previous year's questions and was mainly focused on the recent updates and little typical questions, little difficult questions. But again, INI is a little uncertain exam as well, so we can do our best and just leave the rest. Whatever is going to happen, we're going to see on the exam day, but we can actually do this thing, that we can solve our previous year's questions. And most importantly, last 5 to 7 years previous year's questions will do. But if you have time and if you feel like you can obviously devote more amount of time for previous year's questions, then go to last 10 years questions as well, right? They are for sure going to give you an extra edge, because sometimes INI give direct repeats exactly, like I don't remember the year it was in, but that question was very directly asked in, same question was asked in 2012 or 13, and the same question was repeated in that particular year. So yes, INI is very much about previous year's question, but apart from the previous year's question, you need to also know what are your concepts and what are your main notes actually like, okay? Also, you need to know that INI is very much about the first and second prof subjects. Not that I'm saying that the final year and third prof subjects are not important, they are important as well, but INI focuses more on first and second year subjects. Like for example, in anatomy, they focus more on the cadaveric images, you and the electron microscopy images. They are for sure going to put up there, and you will have to identify it. Atlas images will be there, for you to mark or label a particular topic out there. So it's very important for you to know that as well, right? And physiology, they will ask certain graphs, they will ask certain cycles, which is very important. Biochemistry, again, as I told you, certain cycles, they leave spaces and they'll ask you what is going to come out here. Pharma, new drugs are going to be asked, recent updates. Pathology, histopathological images are going to actually come, sections are going to come, histopath sections are actually going to come out there, right? And microme, obviously we all of us know that there are a lot of images as well, and parasitological eggs are there, so you'll find that. Forensic medicine may actual image is going to come for you to identify what exactly this is, right? So I personally feel if you are very strong in your first and second prof subjects, I feel you will be having a little extra edge from those who are not that strong in first and second prof subjects as well, right? Apart from that, the difference between INI and NEET PG will be obviously that both of them have 200 questions, but NEET has half an hour extra, that it is 3.5 hours, and INI is 3 hours. So you need to plan yourself accordingly. You need to adjust your state of mind in a way that you get to know that okay, I am only having 3 hours and I have to plan my timeline according to that. Now, there are three things which you cannot actually skip for INICET. First, as I told you earlier, it is previous year's questions, right? Second are the recent updates, which you cannot at all skip. Recent updates obviously are available. Three sources I can tell you. First is Marrow. They have a different section of recent updates where they keep on updating it every single day, or maybe in a few days, whatever is coming in the market. Secondly, even DAMS mein, eMedico's app mein, there is a different section for that. And thirdly, all the faculties, they keep on posting on their social media, Instagram handle, whatever the recent updates are actually coming in. Now, do not just go and scroll the social media to waste your time, right? Just go and extract what is very important out of it and just switch it off, delete it for a while, right? So these are the three sources you can get your recent updates at a place on, and it's very important for you to do that as well, right? Third thing will be the emergency medicine, because INI is very much about emergency medicine, and they are going to ask you a lot of emergencies, and they are surely going to frame questions in different ways to figure that thing out. So emergency medicine, there are some platforms which are going to include them in their main videos, the main notes, and for example, Marrow, I guess it has in the main notes as well. But for DAMS, there's a separate course, emergency medicine karke, where they have included all the emergencies of different subjects, and they have beautifully compiled all of them together. So I guess it is going to be very wonderful for you to just go through that particular source if at all time allows, right? So if time is deficient, or you feel like you cannot just go through the entire stuff, then go through the most important emergencies, of the list of which I'll be giving at the end of this video, and just go through that at least, right? Okay, now let's just talk on the timeline of this particular exam, and let's just have a little verdict about how we have to plan this particular timeline we are left with, right? So we have around 44 days in our hand, and we need to understand that these 44 days, if planned perfectly, they are going to be very important ahead in this journey, right? So you're left with 44 days in your hand, and these 44 days can be planned in a way. I'll tell you, divide them in 25, 10, 7 and 2, right? Now 25 days, the initial 25 days, I hope all of you are done with your first reading, and some of you might be even done with your first revision as well, right? So the first revision, if you're done with that particular thing, is very good. You can have your second revision right now. But if some of you you were done only with your first reading till now, what you can do is you can divide these, you can keep these 25 days and utilize them, make your own schedule according to how many days you have to devote to a particular subject, and finish your notes, your images, your previous year's questions, and your 20th notebook, if at all you have started making that 20th notebook, right? Now, when I talk about the images, remember I do put a lot of images as well. So focus on the most important images as well. Do not just go on randomly revising every image which come in front, which is going to come in front of you. Don't do that, please. It's very important for you to just go through what is most important from the exam point of view. Then the next 10 days, which are actually going to be counted as second revision, revise the highlighted part of the notes which you have marked as important previous year's question, or something you have done wrong in your question bank or your GT or your subject wise test which you have actually marked there. Again, revise your images, your previous year's questions, and your 20th notebook. Now, in the last 7 days which you have in your hand, trust me, last 7 to 10 days before the exam are highly crucial, because you have to flip your pages of your notes to have that visual memory and to have that confidence in you that this can make a change. If I talk about myself, I literally flipped the pages of my notes 10 days before the exam, just to have that confidence okay, I have revised all the notes before the exam in my head, and I'll be able to appear for that particular MCQ, although I haven't read those notes from head to toe, but I have just flipped the pages to have that visual memory of what particular thing is placed in my notes at a certain place, right? So in the last 7 days you have to obviously go for your notes and previous year's questions, and in the last 2 to 3 days, whatever you have remaining, you are going to revise your 20th notebook, your last minute revision topics. That is the list of the topics which are highly volatile for you, and the image PDFs which you must have saved in your maybe phone or iPad or tab, because images have to be revised a day before the exam to just avoid confusions on the main day. Alright, so this is how you will keep your 44 days, and just keep one day before the exam. You can obviously revise certain things on that one day before the exam, but I always personally advise that you need to keep that one day for yourself, because anxiety is going to take you over, and it will be very difficult for you to adjust in that particular environment. It's very difficult for us to calm ourselves down, to make ourselves understand it's okay, it's just an exam and it'll happen. You will find so many motivational messages on the social media, and nothing is going to work. Trust me when I say that nothing is going to work, because that anxiety cannot be controlled in a certain way. It is only going to vanish when the exam is going to happen, when you'll be sitting in front of the exam and you'll be over with those 3 hours and you'll be out of the exam hall, and only at that time you will feel like, okay, finally I am done with this exam, right? So as I've told earlier, your notes, your images, your previous year's questions, your 20th notebook, and your last minute revision topics of the volatile list, these are 5 things which are you cannot skip them. These are unavoidable, and you just have to go with that, right? And apart from that, as I told you earlier as well, the recent updates and the emergency medicine is going to be after the previous year's questions are going to be 2 very crucial sources which you have to actually go with that. And regular GTs are very must, because regular GTs are going to make you self-assess how you're performing, what all mistakes you're actually doing, and also to make you adjust for the main exam day. And if at all times conduct CBTs, that is computer-based tests, before the INI, do appear for that exam as well, because it is going to be conducted on the computer centers as well, like the main exam is conducted. So how you have to figure yourself out there, how you have to adjust in that environment, how you have to adjust with the computer screen, the keyboard, and the mouse and everything. So you just get to practice the main exam scenario before the main exam actually, right? And those of you who are done with this thing and feel like okay fine, what extra I can do to boost my preparation, what is extra that I might help me and give me an extra edge in the exam, then one source is AIMS capsule, which is conducted by DAMS, and which is really fruitful, because they have incorporated the very important and very crisp and concise content there in regards to the INICET exam, right? So it has to be specifically taken into consideration only if you're targeting for INICET. Somebody who's going for NEET PG, I don't think it's required to be done, because they have the most important the content there, right? And the second most important source is going to be the preterm baby package. These are certain videos on YouTube which are from AIMS Delhi only, where they are going to actually show the real life videos as they, deal with the cases in the emergency or maybe in the ward. And sometimes the direct video is going to be coming in the main exam as well. So for example, Silverman Anderson score, right? So you need to know what score is given to what movement. So for that you need to know na ki movement hoga kaise. So you have to see that video as well. So you can obviously go through these videos on YouTube. Now AIMS capsule and Peter BB package, these are two courses, these are two resources which you can do only to boost your preparation. There is no compulsion that you have to actually go with these sources, right? So if at all you have time and you feel like, okay, now what next, you can go ahead with that. Otherwise, just stick to your notes, previous year's question, images, your 20th notebook, and last minute revision topics. That is it, right? Now I will give you a list of certain topics which I figured out when I was preparing for my exam, going through the previous year's questions, attempting the main exam, and going through different GTs, the tests and discussions and everything. So I figured it out that these are very, these are important topics which at all are supposed to be done if you are going for INICET, right? So I will just tell you this list, which is, first of all, inborn error of metabolism, highly important. You have to know this, very importantly. Toxicology, very, very, very important. They're going to ask you any poisoning, they'll give you clinical features, you have to come to either a diagnosis or you have to tell the treatment. Then vitamins, highly important. They are important from INICET point of view and NEET PG point of view as well, because this year NEET PG asked around 8 to 10 questions on vitamins only, right? So it's very, very important topic. You need to know the different clinical features of deficiency and toxicity of each and every vitamin, and if at all there is a specific cycle which is in relation to that particular vitamin, right? Then immunology, very, very important. Genetics and molecular biology, highly important, because they really focus on different techniques which have been invented in genetics. Then acid-base balance and electrolyte, again they're going to, and it's a very simple and straightforward question of you diagnose is this a metabolic acidosis or alkalosis, right? So you just need to know what are the exact features for that particular thing out there. Then ECG, very important. Now ECG, they won't ask you something very difficult. They put very different, very simple graphs and very simple, appearances of different disease. You just need to know the basic appearance of ECG in the different diseases, right? So, and also the techniques to identify that, and if at all required, what will be the next investigation or the treatment if the patient is going to land up in emergency with that ECG, right? Blood transfusion, then nerve injuries and their respective tests, a very important topic in ortho and anatomy both. You need to know all the nerves, what are their specific actions, what all muscles they supply, and what are the specific tests you are going to actually do to identify the nerve injury, right? Trauma, it's like highly important. You cannot skip that. It's very important from emergency point of view as well. And in surgery, you will have trauma, breast, thyroid, general surgery, GB, colon and hernia. This is something you should know from surgery point of view, because at the end of the day this is going to fetch you a lot of questions in the main exam, right? And also in surgery you can have lines and tubes, and BLS and ACLS, obviously you can take it from anesthesia point of view or surgery point of view, both of them will work, right? Then again, psychiatry will be a short subject, but again, psychiatry, they ask you a lot of questions from delusions, from the thoughts, from schizophrenia, from eating disorders. There are a lot of questions which are going to come from that part as well, so please focus on that. Now pharma in whole, it's important, because I told you first and second prof subjects are highly important, but pharma may do focus on the recent updates, the new drugs which are coming out there in the market, and some unique drugs for different diseases. Right, so do focus on the drug of choices in pharmacology. Then hepatobiliary system in surgery, in context with the radiology as well. Do focus on that as well, because it's highly important from trauma point of view. Also, all the important vaccines. Now PSMA, you need to know all the vaccines जो पहले थी and the ones who which have been there in the market now, the recent updates. Do focus on the recent health programs which have been launched in PSM now, and because INI is again going to ask you the recent updates only, right? Then the sexually transmitted infections, their kits specifically, very important. Learn that, revise them a day before the exam. The Mullerian anomalies, they will have an image in front of you, and you are going to be asked to diagnose that particular anomaly, or what is the characteristic clinical feature, or what is the next step, right? Then biostatistics and epidemiology, you cannot skip that at all. Although from last, I guess, 2 years they haven't been asking few questions from biostats very much, but But again, INI gives a lot of weightage to biostatistics, all the formulas, all the numerical based questions, and epidemiology, right? Do write all the scores and classification at a single place so that you know what other classifications you have to revise in the end, and what all scores you need to remember. Like medicine, with them so many scores which you have to recall and remember when once the exam is approaching. So write them all at a place together, right? Then sleep physiology, again very important topic. Leprosy, highly important. You need to know what are the characteristic and defining keywords to diagnose all the different 5 types of leprosy, and you need to be very thorough with that. Then all the emergencies, as I told you earlier as well. Carcinoma cervix and pap smear, highly important. Amenorrhea, very important. Labor partogram, very important. In fact, NEET PG 23 had a partogram, and it asked to diagnose that particular thing and what will be the next step of investigation. So please go for that. And hematology is highly important. Do hematology from the point of view of medicine, path and pharma, right? path में भी hematology है, फिर उसका treatment आपका medicine के अंदर भी है, and hematology में drugs हैं आपके pharma में. So do it together so that you do not waste your time in doing it different subjects, right? Then obviously coming on to this particular thing out there, when we talk about this as the emergencies, obviously as I told you, emergencies are equally important and you need to be thorough with that as well. So I'll just very quickly tell you what you have to do. In emergencies, you have to focus on stroke, subarachnoid hemorrhage, and intraparenchymal bleed first. Second, coma, increase ICP and brain death. Third, trauma, head to toe. You have to know everything about trauma. You cannot just skip it. Then fourth, pleural effusion, pneumothorax. Then cardiac tamponade and cardiac tamponade. Then arrhythmias, perforation and obstructions, acute abdomen approach. Then you have pancreatitis, then उसके बाद pulmonary embolism, aortic emergencies, shock, asthma, COPD, pneumonia, GI bleed, toxicology and substance abuse, and without any doubt BLS and ACLS, right? So these are few topics which I have told earlier which you need to do from INICET point of view, and these are certain emergencies which you need to know from INICET point of view, right? I will be attaching these in the video as well. I'll be posting them on the Instagram also, so that you can obviously have a list of all of these with you for the main exam. And I hope all of you will be doing and going ahead with this preparation wonderfully, and will give INICET a shot. Even if you are not prepared completely, it's okay. There is no need that you have to enter into every exam with full preparation. It's okay if you're not prepared. Just go and give it a shot, and just figure out how the main exam feels like, and just have faith in yourself that it is easily doable and you can do it. Okay, whosoever comes and tells you that it is INICET, it's not your cup of tea, you will not be able to do it, just delete that person from your life for a while, and just make yourself believe, have faith in yourself. You can do it, and you will do it if the strategy is right? So keep going, keep hustling, and just keep going with the flow, howsoever it is going. Don't be so harsh on yourself. Take regular breaks, and give yourself the required amount of rest as well, a day before the exam and also in these 44 days before the exam. And I hope all of you are going to shine, and all of you are going to do perfectly well in your exam, right? So till then, take care, all the best, and take care of yourself. Bye bye.